Dr. Pejham, let's talk about asthma and, the normal cough. Maybe explain to us, when there is a difference, what mom should be taken care of, how can it be helped?
Well, asthma is a chronic condition. It has to do with reversible airway when they get some tightness, some inflammation in their airway, and is reversible by using a certain medication. So by definition, that is considered asthma.
Can I interrupt
asthma
you
doesn't just happen one time. Oh, sure.
Can I interrupt you?
Please.
Just explain to me, asthma, bronchitis, same thing? No?
Well, bronchitis, the symptom of wheezing and inflammation in the airway may be the same. But again, asthma is a chronic condition where bronchitis usually is set on by some sort of infection that's self-limiting. It may take a week to maximum 3 weeks, and then you're done. Asthma, however, is a chronic condition where the lungs are just sensitive. They may respond to a virus and get inflamed. Then allergen can come by and make it inflamed. They could exercise, and that's just a fact of fast breathing can cause an inflammation. So no matter what the trigger, and there usually is more than just one type of trigger, it causes inflammation. And people probably because of just kind of a misinformation get very upset, and they're very defensive when we tell them that their child may have asthma, because they think, oh my God, my child cannot exercise anymore, can't do anything, he's doomed. But the fact that asthma's treatment has advanced so much in the past few years has been amazing. As a matter of fact, we have our asthmatics do their full activity without any symptoms, no hospitalization, no emergency room visits, as long as they follow a certain regimen. And not only, sometimes not even year round, just a certain time of the day, a year, they need to follow a certain regimen. So we have peak flow meters, we have pulmonary function testing machines, we have nebulization, we have all sorts of equipment to analyze exactly and diagnose whether or not one person has asthma or not, and of course whether or not it's well controlled. So this is one of our areas that we specifically have a special passion for, and really have specialized in addition to our general practice of pediatrics, of course. And it's a passion of mine. That's where I do my research, and that's where I develop my iPhone application to help asthmatics, not only in my office, but all the way around the world. And it's been well received, and it's one of the award-winning iPhone applications for asthma.
Absolutely great. We'll talk more about that, because I'm sure that needs to be explained a little bit. I can't think of what my iPhone might be do for my asthma at this moment, but I know this iPhone has lots of things I can't think of in myself. So, let me ask you, if let's just say a child has the normal everyday cough, or every so often gets the cough, maybe during the flu season, whatever it may be, or some bronchitis, because it's all very nebulous what starts, I guess, and it's sometimes not even important what you call it, because in the end it's, person there is coughing. But is it possible that if a mom doesn't take care of the child correctly, as the child gets a few times a year a cough and a bronchitis or whatever it might be, that it can turn into some type of asthma, or is that a natural? Yeah. Go ahead.
There are certain infections that have been shown through studies that they actually have increased the risk of those kids who have come down with those infections, their risk of having asthma in the future. One of the viruses, for example, is called RSV, which as a young child, it can definitely cause a severe wheezing. And those are the kids that have been shown to actually have developed asthma when they get slightly older. Again, the treatment is the same. We kind of analyze lung function when someone comes in complaining about the cough. And if it is consistent with asthma, we have a further evaluation that includes allergy testing, pulmonary function testing, and a few visits to really decide what should be the medical regimen to treat that particular level of asthma. So We take it very seriously. There are certain questionnaires that parents fill out to give us really a lot of information. So, again, it would be very easy just to give a medication and say, we'll see you later. Just take it as a puff and you'll be okay, rather than really explore it and make sure that child is able to sleep at night. It can exercise and do their physical activity well. So we go really out of our way to make sure our patients are under complete control as much as we can get there.
Well, I think that's a very important point, because we know, for instance, some of us adults who snore, and not me, but some of us, and we might not necessarily have this thing called sleep apnea, where basically we stop, breathing and don't quite sleep now, and not sleeping at night, not going to the full sleep is major. And yes, any one of us who has had one time or another had a cold and a cough throughout the night knew that he wasn't sleeping. So there it kind of, with sleep apnea you might not know it. But the point is, a child which doesn't sleep, so it's not only the cough which is devastating, it's now the child doesn't sleep. So now next day, he's literally half brain damaged, or at least brain dead for that day, because he didn't get the sleep. And if that goes on longer, how do you expect him now to concentrate in school and to, never mind concentrating, but to get and retain what he learned? And again, all kinds of other problems now come up. Have you noticed that? Is that something mom should be concerned of?
Absolutely. I mean, that's actually why we do well visits. A lot of parents say, well, my child is not sick. Why should I come and see the doctor? These are exactly the kind of anticipatory guidance that we tell parents during their well visits that we encourage people to have once a year. Kids are not just adults from the get-go. There's a lot of changes that happens in their bodies over the years. So there's a huge difference between an 8-year-old and a 12-year-old, even though it's just a few year difference. Their development is different. What they can do is their bodies are completely different. Their brain is completely different. The way they think, the way they analyze. So during the well visit is when we sit down and really chat about, how much of a sleep are kids getting, what is recommended, because just like you said, the kids that don't get enough sleep, they act like, they cannot focus and pay attention. So a lot of misdiagnosis of ADD or attention deficit disorder can be given to kids that simply just did not get enough sleep. So the first thing when people come to us telling us kids are not doing well in school and they can't focus, the first question I ask them is how well the child is getting sleep. How many hours of sleep is he getting? And like you said, every sleep is not different. If you have sleep apnea or if you have a problem and keep waking up in the middle of the night, that is not a restful sleep. So we want to really get to see if the children are getting adequate restful sleep and whether or not that is the cause for everything else that the parents are noticing. So it is an important thing. It's a part of our well visits that we do, and we encourage our patients to maintain their annual well visit so we can go over all these health questions that really makes a huge difference, yet it's not something that the child may directly complain about.
Right. Well, in fact, I guess that's a huge cause in lots of areas in our life. We might have a headache, a major migraine, and if we only look in the head for the migraine, we might missing the point, because we might have a jaw problem here, we might have a out of whack or hip, and all kinds of things might happen, blah, 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 whatever that might be. So there's so many things. So a child not doing well in school or being dull in life kind of doesn't want to play. For instance, like my wife, when she met me about 24 whatever years ago, she had, at some point she started arguing with me, and she says, "Are you upset with me?" And I go, "No, honey, I'm not." And, "Honey, are you upset?" And I got upset because she's asking me about whether I'm upset. And it took her, I don't know, a year or two. Finally, she says, "I now know what happened when you're upset." I go, "Honey, I'm not." No, she says, "Sorry, okay, let me just. You are tired." Because when I'm not tired, I just talk a mile an hour and I'm out there and do. But when I'm exhausted and tired, for whatever reason, maybe didn't sleep, maybe didn't eat, whatever it was which made me tired, I was a lifeless vegetable. Just sitting there, driving there, sitting on the kitchen table. So children could be doing that same thing. So you deprive them of their social life. Everybody thinks he's an antisocial guy, can't make friends, when he really is too tired to make friends. And nobody figured out that maybe, yes, he had a cough, but actually the cough, the big problem of the cough was that he isn't sleeping or something like that.
Right. Yeah. We try to, when kids come in, they feel down. They can't, maintain their friendships. They can't do their homework. They can't concentrate. All headaches, all of these things. Like the first few questions we ask them, sleep is in there, because that can lead into multiple problems that are indirect. So, people may not just make the connection themselves, but we call it, we have to consider that as a part of our differential diagnosis, a list of problems that you may have based on your symptoms. So we just kind of ask these questions and narrow down to diagnosis. And surprisingly, a large portion of these kids are not getting enough sleep. They're staying late. They have to get up early in the morning, and they just don't understand that the brain needs rest to be able to function properly the next day. They think it's just, sometimes a waste of time. They want to just stay up as late as possible. Of course, they have to be dragged out of the bed in the morning, and they feel the same thing during the day. They start falling asleep in the classroom. They get distracted easily. They have low patience. They get into fights. They don't make the right decisions. They have poor impulse control. Everything you can imagine that an attention deficit child would have, except they don't have a chemical imbalance in their brain. All it is just they're not getting enough sleep.
Right. Well, I like your, it's important to do wellness visits because obviously that's probably where the saying came, an ounce of prevention is worth a pound of cure. You got to take care of it. While you're doing well is the best time to stay well. Everything else is catch up in most cases. So thank you. It's good that you doctors are here to help us with the catch up. But what most of us forget is you help us actually, you're supposed to be here, and that is really your ode to, so that we never, if possibly, need a catch-up.
That's right.
That's the wellness.
Preventive care. That's right.
Yes, thank you very much.